All right, if you are online, please sign in the chat. It's 11:57. We will start the meeting here in 3 minutes. 3 minutes.
Hey, guys. How are you? I know that helps your soul. Growing your and I don't I was like, give me this one's killing my. Oh, if you're here in the building, make sure you sign in on the sheets up there. If you're a visitor, it's phone sheet. You have to give me your information. If you're a member, your name's already here. I just signed. Yeah, I'll sign. Yeah. Sign an initial, whatever, some marketing is preferably on your line. And not somebody else. Yeah, right. You know, you should have been so like, I know. Yes. Yeah. What? Okay. We can just stand up here, right? Yeah. We don't have to do like a tap. I don't know. I mean, is that an option? It wouldn't be good, so I think maybe just. It can be entertaining and that in itself is good. Oh, yeah, there you go. Well, I think maybe she used to. Well, I did. I have about a few years. Senior citizen, yeah, this where he goes. Yeah, so the owl will pick up whoever's talking, it'll rotate around. Oh, gotcha. Okay, perfect. Yes. When he like at we're 11:59. He went for the you didn't get food. There's green chili stew in the back. Yes, we will. If you're online, there was green chili stew. You missed out. So there. Definitely missed out. Yeah. I was free eventually stew on top of that. I was out in town. It was the one. Don't forget. Thank you. We're gonna get out. Okay. Smells like. All right, it is now 12 o'clock. In order to make our 1 hour time frame, we've got to stay on track. So I'm going to go ahead and call this meeting to order at 12 o'clock. Thank y'all for being here. We're gonna do announcements at the end of the meeting. This way, if we have the time for it, that way you guys get more time on that one. As far as membership goes, we started this fiscal year with 95. We are currently at 108. I have to say our last month's participation was impressive. It was 46% of the membership was in the meeting last month. That's the highest we've had in a year. Keep it up, come back, because we won't have that today. Our new members are Ms. Sullivan from the Rural College of Osteopathic Medicine, Erica Diaz, Project Hope, Tamara Letcher from CYFD, Layla Salvo, Sabrina from Rustic Health. So welcome to the new members. In your packet are the minutes from last month. If your name is missing and I miss you, please let me know. Did anybody have any corrections to the agenda, to the minutes from last month? All right. In that case, we are going to move on.
Do we need to approve of it?
Nope, unless, no. We're not doing business style meeting here. That's what the board will do. So we don't have to go through approvals anymore. Hang on. So we're going eventually. Everybody else online, to make sure you put your information in the chat box. Jennifer needs to get the attendance for the gift card. If you're not in there, you get missed, and then you don't get credit for attending such a wonderful meeting and missing out on some green chili steak. All right, with that, we do have a funding request from Road to Recovery.
Oh.
And I will let the Road to Recovery peoples. Somebody present.
What is that? No, about that. Loretta on? Is Loretta on?
Loretta, are you on?
So let me go back to my notes. I can't remember what it is.
Okay, so according to what she sent in, Road to Recovery is asking for $263 for.
Doesn't say what it is. Insurance maybe.
Yeah, it doesn't say what it is.
That may be what it is, because we did, let me go back to our notes. Sorry about that.
We have in 2022, we donated 1 to 88 for event insurance. Based off that price, I would say it's probably the same
I
thing.
think she does really good, yeah.
They are members of the Health Council.
When is their walk gonna be? It's scheduled for January 24th. At the Bowl at 10 o'clock. And I do believe it has to be insured, because there's nothing else that I can think of. The last meeting was, because she did discuss insurance briefly, now I've been watching, of course. Okay. I just text her, so I sent her to another meeting, another coalition, so I don't know if she's on the holiday.
And the insurance is for that day or for?
I think it's
For the walk.
specifically for that day, like a liabilities.
Yeah, so anytime you use any of the city, the county, some of the larger venues, you have to have, insurance, liability insurance. Our insurance for the Veteran Symposium was 100 and. It was just under 200
Did it cover a month or 2 months?
that day. It was just that day.
Just the event.
Just the event.
That's about how much I paid for the tours for Tots, and it covers from like a September to the December timeframe, but then again, that's a big organization.
Well, it's that event, and that event is that long. Our event is a 1 day event, so it covers that day.
That's about what roller derby costs. For one day of it. Yeah, because the only prepping we do, we get into the field the day before, just to kind of look things over. We're all there that morning, and we'll talk about the afternoon. What day is that? January 24th. At 10. 10 o'clock, 10 o'clock.
Does anybody online have any questions about the request? This we will have to take a vote on, because we'll need to know what membership wants to do. And then from here, it goes to the board for, the final approval on it.
Okay.
And then after their event, they have to come back and provide us with a presentation on how the event went.
Okay, yeah, we can do that.
Does anybody else have any questions?
But together with veterans, do they have a list of the veterans that participate too, in a way that help with the data for together with veterans, or I'm just talking out loud?
So for their event, for the Road to Recovery, for them to track veterans,
We can do that. We probably have to put it in our, registration, form, just so that we can track them that way. But if it's something that you need, we can do that.
It's veterans data, we're together with veterans, we're driven by the veterans data, any where veterans are, this is something good for veterans.
And we have had veterans, participate. So we have a few that I, on the top of our head that do participate. So we can get you that information with the meeting.
so then in that case, if we're gonna do the extra work, then I would recommend that the Together with Veterans program promote heavily the event to get the extra participation.
Okay,
I could talk with Danny about it, the coordinator, I don't wanna make a decision without her knowing about it, but.
okay, we'll
Okay.
exchange information that I can keep in contact, okay? You accepting organizations?
I know she'll be heavily, but January is a good time for me, I can help out. It's after the tours for tots, so I can take over that. She needs.
Anybody else have any?
Stephanie online, raise your hand.
Stephanie, go ahead.
I was just wondering, do we have money in the budget to cover this? And if so, I think it might be a good use.
money in the budget to cover
Yes, we have money allocated to cover this. We do sponsorships or donations to the community every year.
And we budget it in our budget meeting every year for health council. We set aside a certain amount for sponsoring organizations like this. That's why we have sponsor request form.
And we need a motion to.
I need a motion to,
I might ask one
Motion to approve the $263 for the Road to Recovery 5K walk.
I have a motion to approve $263 sponsorship to the Road to Recovery 5K. Is there a second?
I'll second.
Sonia is a second. The motion was made by Geneva. And now it is open for discussion.
And my question was, do the, Road to Recovery, do they help people in the Chaves County
Yes, we do.
all the way to Lake Arthur?
I'll throw it next to them.
Okay.
How many participants do you remember how many they had last year?
Let's see, last year, I think we had a total of about 35 participants.
Which,
And then they had online walkers too. Yeah, we have online walkers, different states. They provide their information virtually to us, so we know who's walking in that capacity.
Any other discussion? Seeing no other. Was there somebody online? Seeing no other discussion, all in favor? Aye. Any opposed? Motion passes. It will go to the board meeting at the end of the month.
Great.
And then after that, we can let you know what happens from there.
Very good. Much appreciated.
Alright, next item on the agenda is our FY 26 proposal. So if you remember from last year, our proposal, this is what we create our subcommittees for. This is the stuff that we as a health council, we do within the community. This is separate from what we do for any of our grants that we have. This is in addition to, and this is where we need people to join in and say that they want to help and participate, or it's something that we don't want to do. So if you look in your packets, you will see our activities, projects, initiatives, blah, blah. Operations, that's the board, that's where they'll do that part. We've got veteran support, which is tied with our Together with Veterans program. We have the youth education and awareness activity, which currently is tied to ZAG, business fair for youth entrepreneurs. We have the annual Chaves County Health Expo. We've got the 211 information system. And then we have the Behavioral Health and Wellness Subcommittee. Does anybody have any questions about those? You'll see the partners that we need within those areas. In the veteran support, we need government, veteran organizations, veteran-owned businesses. We need veterans to talk to veterans. The youth awareness, we need school youth programs, Wings for Life, the extension office, parents. The health expo is everybody in town. 211, this is gonna be a really large, big project that's going on because this is us moving into Find Help. We'll be the only 211 system in Find Help, which is the closed loop network. So we're gonna be building that and we need to work with the faith-based nonprofits, government organizations, the medical facilities, anybody who provides a service needs to get their information put into Find Help. So that way we can get the information out to the people. And again, this is a closed loop network and this is through the Healthcare Authority. So all the navigators across the state will have access to this information. So if they're, say, at UNM in Albuquerque, but they live here and they're coming here and they need a resource from here, they can go into the system and find that resource and make that connection. So that's that. The behavioral health and wellness, we meet 8 o'clock bright and early on Wednesday mornings. And this is tied to the funding that ultimately is coming down through the state and it'll be tied to the AOC stuff. But this is trying to build all that behavioral health. Again, we need people who want to join in on these committees. So you'll see I did work plans for everybody. I'm gonna skip operations since that's the board. The veteran support, it's a number of unmet needs identified and addressed, is trying with the veteran support, it's a veteran focused event, which is either gonna be the stand down or it'll be the veteran summit symposium. Give me a minute. We do QPR training. And then we'll do a marketing campaign and tie it to gun locks. Since this is a rural suicide awareness program, community-wide forum. This is tied to our chip. And since our chip is tied to the stuff that we do together with veterans, we kind of put those organizations together. So if you are interested in that, please let me know. And we can get you on those. The youth education and awareness. This one is creating entrepreneurial skills, confidence, career readiness, economic and community impact. We decided to go this way with it because nobody was kind of doing this with the kids. There's groups that are doing things that are close to this. We're just taking it to a different level. So that way those groups who are doing some of this base work will now have an outlet because we're creating an event where they can actually sell. They create a business, they make their product, they sell their product. If it's a good enough business, it can actually get them going on. We've got a high school student who's gonna graduate and we have a feeling that he has a project that is literally gonna become his project as soon as he leaves high school. Health Expo, again, most of y'all have been in most of those meetings. 211, we're working on increased access to services. Ease of use, this will also, besides the closed loop network part of it, it also has it so that the public can access the resources. And then we'll have it where we can download this information and continue to print our resource guide, so that way we have that. It's trying to tie everything into one area. Behavioral health, collaboration with partners to improve behavioral health in our region or in our county. We have to do a health assessment. Does anybody have any questions on the proposal, the plan, any changes, anything that you think we don't want, any comments, questions?
If anybody wants to join any of these subcommittees, please do. I'm on two, so
Yeah.
I lead on two, I should say.
Is
So
the,
it'd be nice.
training underneath the behavioral health?
Because that's tied to the
A
overdose grant. It's not really, but I mean, it is, but it isn't.
Okay.
I mean, it fits into our behavioral health plan. It's just not part of it. Again, when we have separate grants, they kind of do them separate.
Okay, this is just
This is
your
just,
requirements from the state.
this is not a requirement from anybody for anything.
Okay.
This is what we as a health council want to do for Chaves County. The other stuff is what we're mandated to do. This is what we want to do.
And when were those meetings for the behavioral health?
They are, the next one is September 17th. At 8 AM, and it'll be here, but it's also on your packet on the first page.
What's the third Wednesday?
I believe it's the third Wednesday.
Thanks. It's too early for.
So last year we took a vote to see if we still wanted to do these. Do we need to do a vote or? We're just telling you to approve that this was gonna be our plan on what the health council is going to do for the year. Do a vote. All right, with that being said, does anybody have a motion to accept or reject the proposal?
I move to accept the proposal.
I have a motion from Geneva to accept the proposal as written. Is there a second?
Second. Yes.
I have a second from Sonia. Is there any other discussion? Seeing none, all in favor?
Aye.
Any opposed? All right, the proposal is done. Woo-hoo, yay. With that, Elizabeth, are you on? Dan, can you do the behavioral health, and wellness update?
Sure, I'll do a real quick update. Our meetings, I see that Victor in the chat has asked where it is. So I'll hit that one first. Carrie, remind me, is it still going to be held in that same room that y'all are in?
Yeah, so the Behavioral Health and Wellness Committee meetings are, the next one is September 17th from 8 to 9 AM. Here at 500 North Main, Suite 102. Will also be done via Zoom and, all of our meetings are on our, webpage under events, and so you can get all your Zoom links there if for some reason you can't find them anywhere else.
Thank you very much. And we've been doing meeting regularly for those behavioral health updates. We did create a public survey that we want some at the health. We had responses on that, so behavioral committee to do kind of a summary for that. So at our next meeting, we'll be sharing that along with the raw results. We'll also be talking about some of, Carrie brought up the coordination with the Administrative Office of the Courts, the AOC. That is part of last year's legislative appropriations that came out in Senate Bill 3 for behavioral health care reform and was funded through House Bill 2 through the general appropriations. So Chaves County, Eddy County, and Lee County are part of District 5 of the system. And so the county, in order to identify needs, gaps, and goals that they want to focus on going
Geneva, update on youth education?
Yeah, the ZAG is doing really well. We have, sponsorships from Eastern, who is our biggest sponsorship that came in with 3,000. Richland came in at 1,000. We had, Fulkerson at 500 and Economic Development came in at 500. We had, oh, yeah, and Chimera, and Chimera at 500. 250. 250. We had 26 sign up. And then the first day, 23, I believe, came, and then we lost a couple due to, the COVID and sickness. And required was that they came to the workshop, which Carrie created the curriculum on for the business plan. It was awesome. And then, 2 weeks ago, we had where the kids presented their business plan and their pitch to our sponsors. We had 3 of our sponsors there. They were our Shark Tank. It went fabulous. All kids were receiving some type of financial assistance through, the money that was sponsored. So they got anywhere between $25 to $100. Like Carrie said, we had some kids, some really great ideas in economic development, and a few other potential sponsors, have looked at, one in particular, the 17-year-old, who this could be his future business. And a lot of these could be future businesses, so it will be October 25th. We from 10 to 2 at Eastern. We think we're gonna have a huge turnout. I know Carrie's working on the flyer, so we'll start getting some PR around it. So come encourage and support these young minds. They're from ages 8 to 17. Of these kids that will have their booth out there. They'll be selling their stuff, so. Very, very awesome. We already have a lot of people reaching out saying that they want to be involved in it next year. And then, what we'll do is the kids that have come through it, if they want to be involved with it again, they will be the mentors for the next round. So, any questions?
Any questions online?
Nothing in the chat.
All right, thank you, Geneva. Together with veterans update.
So we're still working on planning stand down. If you know of any veteran serving organizations or organizations that serve the homeless population, please get with us. Our next community team meeting is October 18th. And it is at the American Legion Post 28 at 1620 North Montana. We have a list of organizations and divvied out responsibility to contact those organizations to try and get them on board between the community team. So we're just working through all of that, getting everybody on board. The stand down is planned for February. Let me make sure I'm getting the date right. So I think it's February 6th. February 6th. So we are planning for a 9 to 6 timeframe. So that it's an all-day thing to give our homeless population plenty of time to come. If they want to be there from 9 to 6, then they're welcome to be there from 9 to 6. But definitely want Jocelyn to be part of that as well, if you can.
The 18th is at a meeting.
Yeah, 11:30 to 1. And we provide lunch for you if you come, and childcare if needed. And we are doing our next QPR training. Carrie's got the flyer up. It's in everybody's packet. It's on November 15th from 12 to 3 at the American Legion, Post 28. Anybody can come. You don't have to be veteran serving. Anybody can come for the QPR training. We just want to train everybody. So you can sign up by calling the Health Council office and getting signed up, because we do have a maximum number of people that we can train. And I believe Rebecca Cobos is doing this training.
Any questions for together with veterans? Alright. Um. That takes us to our very first annual report. For the Health Council, and you can go through it real fast. I'm not gonna hit everything, but this is basically, this is what we did for all of last year. Goes into our history. What, you can see what our initiatives were last year and then compare them to what our initiatives are this year. This is that FY 25-26 proposal. So this is where this information goes. This is how we tie it all together. So that we tell the community what it is that we're looking at doing. Here's our community impact. The majority of the people that are part of the membership obviously come from the healthcare, and then 27% is from nonprofits. So you can see our numbers in there. We did have a, what was it, almost 100% growth, because we went from 50 to 95. We organized resource meetings, Chaves County 211, information, you can tell again. Our top needs in the community last year, of course, was the disaster services, hands down was our number one call. But then it's fertility assistance, rental assistance, homeless, hotel shelter assistance, and food banks. We had 4,229 total calls and texts through 211 last year, which is the most it's ever had. We distributed 809 gun locks throughout the community last year. The Health Expo, we've already gone through all of that. We did a food drive, which helped with Food Not Bombs and Food at Alianza. Together with veterans, they purchase and pay for veterans bus rides, so all veterans can ride the city bus for free. They did 5,425 free rides last year. Last year, it was a third symposium, but the first time the Health Council kind of took it over. And then this year, instead of doing the symposium, we're doing the stand down. And then you can see our statement of activity, so you can see the accounts and how we utilized our funds. Any questions on the annual report? Kathy?
Sorry, I had a phone call. I was looking at the Health Expo. Did we settle on a specific number of how many they think the attendance was? Or did we just leave it how many were? I noticed it's
So the annual report was not this last expo, it was the one before. So this is our report for last fiscal year.
Okay, thank you. I'm sorry, I had a call, but I had.
That's okay. And those numbers, and you'll see because the Health Expo was so much later in August, the numbers are really low. And then this time next year, you'll see this fiscal year.
They were spectacular this year.
Yeah, so you'll see that.
Okay. Thank you. I'm sorry to interrupt.
That's all right. Any other questions on the annual report?
I just wanted to know that, just reading this report, it makes my job easier, and I wanna thank Carrie because she's doing a marvelous job getting all her stuff into us, the Department of Health. And I wanna acknowledge, this picture down here. The flood is coming up, the year anniversary, and without Carrie and what she started, I don't know what we would have done, you know, half of our community. But I think all the people. But, thank you, Carrie, for this report.
Very welcome. The goal is to make sure that we do those reports every year, because you're gonna be missing all the business end of the Health Council now. To focus on the community needs pieces to it, and this will give you that information, keep going on it. All right, if there's no other questions, then we will move over to our speakers and look at that 12:30.
It just seems different, the 130 at the Veteran Symposium, it seemed like it was so much more. But I guess it was the helpers that seemed more, it seemed like it was more than 130 veterans.
130 is still a lot for a
Chavis County.
specific population that's still really.
But I guess I was counting all the booths, the people in the booths and that information.
Yeah, we can only go by the numbers
Yeah.
that are handed in on the people who count the doors. We're gonna have to get some better ways of counting and tracking and doing some stuff, especially using the mall.
Oh, the mall's hard to get.
Lots of, any other questions? No. All right, with that, so today's meeting is all about food insecurity, or food and nutrition. So we have two speakers. We have Jocelyn Smith from Food Not Bombs. She'll go first. And then we'll have, Healthy Kids Chavez County. Becky Joyce from Holly Camp. So take it away. Yeah, you can do it from there because, the owl will actually find you.
So I'm Jocelyn Smith. I run Food Not Bombs Roswell. We serve free food to anyone that's hungry on Thursdays and Sundays. We are a no questions asked policy, so it's hungry, you don't turn your way. You don't ask for any kind of identification or paperwork. We do set up at Pioneer Plaza on Thursdays at 4 p.m. and Sundays at 1. So it's kind of like a dinner on Thursday, lunch on Sunday. So we're trying to close that gap of when people are not getting fed. So I know that Harvest only serves pretty much throughout the week, and then it's kind of like bag lunches during the week. So we can do that. We are food rescue program, so we rescue food from civic events. If there's a big civic event and you have a lot of leftover food, we will take it and we will serve it. We also do any kind of restaurant rescue. If there's restaurants that want to work with us, we'll have your rescue food from there. Currently, we get pizza from Pizza Hut from their buffets. They have leftovers. Any kind of restaurants, they know where to call me and I'll pick up food. So, and we work with one veterans, they come out there, so we're also trying to get other organizations out there to kind of get and talk to people. So we have veterans, we have a lot of people that are seeking help, but don't know where to go. So, and all I can do is just direct them, but we would like other organizations to work with us, maybe come out there when we serve and talk to these guys and let them know what's going on out there and what kind of resource they can get. So we also, we're pretty much a donation based. There is food rescue, or it comes out of monetary donations, or it's coming out of our pocket. We are a mobile unit, so we do not have building, unfortunately. So anything that we pick up, we have to key up at the sort house, which I'm sure you guys know what that is. We do rescue food from that female school. They are our main supplier right now. They are donating all week. So we are picking up food from them pretty much all week, and that's where the food's coming from. So if you know of any schools that would like to do the same thing, just let me know. I didn't print out a lot of flyers, but my number is on there. So, that's pretty much it. Like I said, contact me if you know anybody.
Do you just get food from restaurants,
Anywhere,
rescue?
anywhere.
I run the bereavement, receptions at our church.
Okay,
And sometimes it's catered, sometimes it's kind of potluck.
we've done funerals,
okay.
we've done any kind of, people have called me to funerals, we've picked up tons of food.
And does if it's a casserole and part of it's gone, do you still accept? Okay.
And we are covered, if anybody's wondering, we are covered by the Good Samaritan Act. So that covers me, and so if somebody comes back and says, well, we can't do that.
That was my next question on.
We are covered, so, and that's what I try to tell, like farmers or any grocery stores, like their deli, they're throwing out food, give it to us, and they're covered, so are we, so nobody gets it. And, but yes, thank you, and I'll give you my number.
Okay, is this on this speaker forum?
Yeah.
Okay, okay, thanks.
Where do you store?
Right now we're at the Shore House, which is,
So 100% Chavez County has a youth house. They have a couple youth houses. And so this one is down south, it's the Soar House, where they take in 18 to 24-year-olds that have just transitioned out of foster care, Job Corps or wherever, so they can start college to transitioning into workforce.
And we have a fridge over there and it also facilitates us to heat up there as well, so we can store it. Right now, but it would be awesome to have a building. Sure. Because right now we're not new with their all food, we're pretty much distributing it until it's. So we try to hand it out, we're giving it to Midway on Mondays, we're giving it to the community, different community places on Tuesdays, and then people's their investments.
And I'm sorry, I was reading too. What days are you at Pioneer Plaza?
So Thursdays at 4 and Sundays at 1.
Thank you.
So after 3 days, do you toss it?
Yes.
Oh,
Yeah, it's usually, we'll store it for one day, and if it's like Wednesday, we'll store it Thursday, we'll toss it Sunday.
So yeah, the Good Samaritan covers that pieces as long as the food is held responsibly and utilized responsibly, it all covers it. So it's the good faith for it.
We do not have food fund filled.
No, we are,
Or we actually run out of a lot of the time.
our numbers actually went from when we started in February of last year at the Performance Center, we were serving 40 people an hour. Our line is around. So
That's just not the homeless,
Yeah,
it's anybody.
it's families, it's anybody that's hungry. And we don't turn anybody away. But if you don't have food, you know, I tell people you have to come early, especially on Sundays. Sundays is our busiest day. Thursdays, you know, we'll still have some food, but Sundays food will have pretty much around.
They're always looking for volunteers, so if you're interested in serving the public and getting to know some of our community members, I suggest getting out there and volunteer.
Just by word of mouth now, or?
Kind of, we're just kind of trying to advertise, and, you know, we have a Food Not Box Roswell on Facebook. I don't think we just got on to. Chopsy on here, to look what they can have out.
Yeah,
So we're really trying to let people know that we are out there.
And Dan is trying to, work something out with the bus station to where people need to get to Food Not Bombs on those specific days. That we can cover, kind of like how the veteran services are for, free ride for vets. Dan's trying to work that out. It's in the works, so it's not solidified yet, but it's.
We do have a lot of people that say that they can't get there simply because it's, their transportation issues. We do try to get to hometowns, but with hometowns, you have to pretty much be disabled. You know, you can't get out of your house if people are trying to deliver to you. You can't, but that also requires gas, so, and volunteers. Right now, it's just pretty good.
Do you have a lot of families with children
Yes.
in the line? Well, I'll get with you, give you the information, because I know those families are hard signing up for Toys for Tots because some of them don't have access to Wi-Fi, so.
Right, we do, with our numbers, we do have a lot of them. Okay. There's someone, their perkins, they're, okay. So. And they're hungry, you know, usually they get 2 or 3 plates, so that's.
I'll get with you a way, we can get their information so I can make sure that
Yes.
taken care of.
Outreach, either the hospitals or both the hospitals for their foods, so they both run buffet lines.
We ran, when we were at the hospital for an event, we had talked to them, but,
It's just one or both.
just the Eastern. Loveless, yeah.
Okay, I can ask Loveless if they, what they do with the food when they're done.
That would be awesome.
If they
That would
could,
be amazing. Any, like I said, any food that, will potentially go in the trash.
okay. And if somebody's, say if somebody does have food and you, they can drop it off to you.
Yes,
Is that-
I can drop it off to me, or usually I have to pick it up,
Okay,
or my volunteer.
You talked to Albertsons and I saw someone, the dumpster, somebody was picking, you know how they have those little sandwich and drinks and it's expired? I saw someone pulling some out of a trash dumpster, a homeless guy.
With the grocery stores, like I said, it's kind of hard because they're still really afraid of their corporate thing and they don't.
That,
Even though I told them we're covered, it's kind of like they have to talk to corporate. It's kind of, they the same with Stripes wants them to donate, but they said that they can't. It's sad, kind of like you have to take and choose who will donate, so, but I mean, we welcome anything.
Well, and just so y'all know, Harvest Ministries does drive around and pick up from all the grocery stores. So it's not that they're throwing everything away.
okay.
Harvest does pick up, so I'm thinking it's, again, that Good Samaritan law is only covers certain things. If they're giving food that's expired and truly is expired and past a usable date, they can't give it to you because they are no longer covered.
Yeah.
Right.
So, you know, there might be some more to it.
But with the deli stuff, I mean, I was told that they're pretty much, you can only keep it so long and then they'll toss it.
Right.
And that's where I'm trying to get them to.
I saw some guy, he does pretty good, the one on Second, he goes in and gets some, and you can see it be like the juice things that probably expire and the little sandwich things.
All right.
You said you were getting some help from the schools?
Mountain View right now is our main donor, so they donate their breakfast and lunch all week.
Well, I was wondering, have you talked to the people at the Institute?
I have not, I don't even have that contact information, but I would love to.
Okay. I'll get with you.
Awesome, thank you.
All right, so I'm gonna have to move us on because we have another group here to speak, and this is on Travis County Healthy Kids. I don't know why it's so not working in my head.
That's right. That's all right. Yeah, we're, Healthy Kids of Travis County. I'm Becky Joyce and Paula Camp, and, we're an initiative of the Department of Health. And we're both retired teachers, and this just seemed like a good cause for us to move on to this job. And, our objective is teaching, healthy eating and encouraging physical activity in elementary age students throughout Travis County. So we're Roswell, Dexter, Hagerman, and Lake Arthur.
We have lots of programs that we do that encourage both of the things. One of them that we do is called the 5210 program. It's a 21-day challenge to get the kids to have 5 fruits and vegetables every day, 2 hours or less of screen time, 1 hour of physical activity. And the O is for H2O, to drink water, and we also emphasize milk. So the salad bar is really good for that, for the kids that cafeteria provides. It's used all of the time. The kids love the salad bar. They may overuse the ranch, but at least they're getting the veggies, you know? So that's a good thing. We do that with 3rd grade. 4th and 5th with some of the schools, and all of the schools in the valley we do. It's more of a tying it with the home situation. We have them, we send home a booklet that has a recipe and an activity to do at home. We make the recipe simple because we also want the kids to be able to prepare it. So if they get home and nobody's home, they can pick something that's as healthy as possible for their snacks. We also do tastings in the cafeteria to try to get them to try different food. Last year we did dried fruits. Some of them liked them, some of them really didn't. The apricots looked really bad. So I didn't blame them for eating them, but they tasted good if they had just tried them. We do a lot with New Mexico grown products. We encourage all of the schools and the kids to eat NM grown. And this is from local farmers in our area. We buy from Graves. Well, we don't buy. The schools buy from Graves and use the New Mexico grown grant that the legislature provides. And they use Graves Farm, and then Jeff Nybert has Wind Rivers that he's really gotten up and going, which is really, really good. And they even have, like in October, we celebrate New Mexico grown, and they have a day where, excuse me, all of the food is New Mexico grown, including the meat, because we have processing plants that do New Mexico grown beef. And so we encourage that, and that helps the economy in the state with the gardening and the ranching. We do gardens. Gardens is one of the things that we try to concentrate on. Lake Arthur is working on a community garden that they have people in the community helping to take care of it. And last year Becky and I went, and how many chickens did they have?
Oh,
Remember, tons.
oh, yeah.
Yeah, they had
Yeah.
tons of chickens
And
and they were,
collect the eggs and, you know,
they were selling the eggs as a fundraiser, which was great for their FFA. And, I think they also had a small hydroponic garden
Yeah.
inside their lab.
And then one of the things we did, at Pecos Elementary, they have great, garden beds, out in their playground. And, with automatic watering systems and they grow carrots. And so they had the kids collect, harvest the carrots. And then we took those carrots over to Goddard, and then the Goddard cafeteria ladies, pared the carrots. And then those carrots went then back to Pecos for the kids to eat what they had grown. And, it was a neat, deal for them because then they could see the whole process,
And they saw all different colors. Of
Right, they had
carrots, like
purple,
blue
yeah,
ones and
all the
purple.
different, yeah.
Yeah, they were a little nervous about that.
Yeah.
Nancy Lopez has always been a big champion of gardening. Kim Cavan is in third grade there, and she's always promoted the gardening. She has this year, because they're moving to a new facility later in the year, but she's doing her hydroponic garden, and she'll be growing lettuce that the kids will get to eat in the cafeteria also. And she does even things she grows in her classroom, or she gets pots and grows them. They have a water situation that they're not going to correct because they are moving to a new school. So it's been difficult. And then a huge tree fell on their garden beds. So they can't go to that area of the playground. So it's really good they're getting a new facility. So she's very good to promote it, and then they cook it in the class or fix it in the cafeteria, and then the kids eat it. And East Grand Plains started a garden last year, and Shauna McCarty is the school nurse, and she really got fired up about it and did some education with it. Went to all the classrooms, taught them gardening skills, and then they planted their gardening beds. They're growing beans and squash and onions and all kinds of things. So they're really going strong. A problem we've had with growing in the spring is that there's no one there to water in the summer because we no longer have the funds for summer school. But it happened that Shauna's dad lived down the street from East Grand Plains, so he would help out with the watering, which is an advantage like Lake Arthur. The community gets involved and they can come and help the school with the watering and that type of thing. Dexter is also starting a garden, and we helped them get a grant, and they purchased a greenhouse. So they'll be putting the greenhouse up, and they'll be growing plants, and then they'll be putting that in their cafeteria as well. So we really try to promote healthy eating in everything that we do. Questions? Yes. I'm
How
sorry.
many schools gardens?
I think we have 7 or 8.
And what does it take, like, to have, go into a school and introduce the garden, or how does the process work?
Well, we've done some grants, apply for grants that help pay for that greenhouse with Dexter and in the garden at Grand Plains, like raised garden, the stock tanks, and then they make gardens, raised garden beds, and the same with Berendo, I think.
Elementary,
They're working
yes.
on that, so that, and then some, they just took it upon themselves. I think at Nancy Lopez, they actually talked to the maintenance guys. They had some actually it was Skylar Pierce.
Oh, that's right.
He was FFA at Roswell High at the time, and he found some scrap woods. He made garden beds for them and had the FFA kids build them. And so if you can kind of coordinate with other groups, it was an advantage for the FFA kids to be able to do that and to contribute to the programs at Nancy Lopez. So it all kind of all falls together when they all work together.
And we had some gardening kits that we gave out to different schools and Head Start programs in the preschools. The Head Start in Dexter got one, and then University High got one for their childcare department. And Becky and I went out with them and we helped them plant and had their little pots. And it was just, they loved it. So we try to start early when we can.
The Pecos garden is, I think, the oldest one. Cause they started it when I worked at the school district and that was early 2000s.
Right.
That was one of it. And the reason I laughed on the carrots is, so I was there when we started the fresh fruits and vegetables program into the schools. And I took them tricolored carrots.
Oh, okay.
And they all threw them away. Because they didn't realize carrots come in tricolors. So they said that they were all bad.
Well, it's funny because now, and it's probably the same carrots, you know, they just keep coming back and all they do is water them.
The same one.
Yeah.
Yeah, and they're ginormous and
Yeah.
all deformed and everything, but they still cook them and they're still good.
Yeah.
So that's a great thing. Okay,
There is a grant, ENMU is starting a program, they just received for the GO bond a grant, we're building a greenhouse. It'll be ready, so I'll give you the information. They're gonna, it's part of their program and it's gonna be huge and
good, thank you.
then they can get with someone else, I don't know what they're gonna do with all the vegetables, everything, so.
Right, right. Thank you very much. Okay, thank you for your time.
All right, I am going to share my screen. Give me a minute. Squat.
So I grew up in Dexter, I'm a farm girl. My dad was a farmer, all that, right?
Right.
My daughter was about 8 and she walks in. I failed somewhere along the way. Comes in about 8 years old and she goes, Mom, does corn grow on a tree or on a plant? And I thought. And I so I said, it just happened to be the right time. So I said, put on your shoes. That's our house is always, there's an adventure coming when I say put on your shoes. She put on her shoes, we drove out to a field, found corn, we talked about it, we picked some, brought it back, made her clean it, we cooked it and ate it. She was like,
Oh. This is great. They don't think it comes from a can. You know, they see lots of cans and lots of frozen bags. So it's important for them to see
Where it really comes from.
where it comes from.
And I grew up in the South Garden in rural North Carolina, and they don't do that anymore, and it's kinda happy, I'm happy to come here to this area and people actually grow gardens.
Okay, so we're gonna have to move on if we're gonna try to map out some of these resources available in the community. Which is the whole part of this. So under education right now, I've got Healthy Kids Chaves County. I put it in there right that time.
Okay.
Casa Kids is doing cooking classes and nutrition classes. Chaves County Extension Office, does nutrition education. Is there anybody else that we know of that does community nutrition education?
I don't know about here, but the DOH, I'm going to be working with partnerships with the Department of Health. There are health educators. And one of the ladies is Sarah Tolbert, and she, and the other one is, well, I can get the information to you, Sophie Rue. They have programs, and one of them is on diabetes prevention and control, and they do like, 4-part kitchen cooking classes and courses and stuff, and they're looking for places to do these outreaches. They're out of Albuquerque, but they may be a potential partner to do something like that. I can get that information to you because I know one of the courses is a cooking kitchen type course that she does 5 classes, and we could maybe hit her up to see if she would be interested in doing something like that.
Okay.
I will get that information to you.
Anybody else on the education pieces? Anybody that knows of anything? All right, and this will get sent out with our minutes.
Oh,
Okay.
but we need pictures.
So hot meal sites, I started adding in, I got more to it, so I have a calendar of hot meal sites of set up. That's Alianza put together, which is fantastic, but I know it's missing quite a few on it. So I know Harvest Ministries does, it's a continental breakfast. I have it under hot food, but it's non-cooked food. It's shelf stable. So that way, anybody can eat that as they go. Joy Center is only for 60 plus. Is Joy Center doing any food in the valley or is it just strictly up here?
So there's choice centers in Midway, Egerman, and Lake Arthur.
Yes.
So they are serving food in all the
There are
other.
4 sites.
Monday through Friday in Hagerman, and that Thursday. And Monday through Thursday in Lake Arthur and Midway. They're only Monday through Thursday.
And you said
So I
60
think
and
it's
over?
Monday through Friday at Joy Center, right, Roswell?
Friday is Friday.
Right, I think Roswell has Friday, yeah.
Monday through Friday at Roswell, Monday through Thursday, where?
Monday through Thursday is
Midway.
Lake Arthur and Midway.
And what about Hagerman? Are they Friday also?
They're Friday.
Okay.
So Monday through Friday.
Hagerman,
Roswell and Hager.
And this is at the same time, 11:30 to 12:30 at all 4 locations? Okay, I need the valley in here because the map I have, all I have together does not have anybody in the valley. So I'm trying to make sure, and then my goal is that once I get this all done, I'm gonna steal their calendar. And I'm gonna put it up on the Facebook, not our Facebook page, our web page. And so that way, when anybody, if they need food, you can go there and you can see the times and locations.
I don't know if you guys have access to, but a lot of the MCOs, through Medicaid, will cover meal through mom meals. Which, it can be tailored to like diabetic needs, but it can also be a second. And they go, they'll do 7 days worth of meals 3 times a day. And comes will be covered. They deliver it stuff, kind of like if you look up Blue Apron to you. It's in a box like that refrigerated.
So. Yeah, so that one's harder on the public piece too, because it has to go through the MCOs.
If you have to know, all you have to tell them though is that they can outreach to the number on the back of their card. But it just if you need that.
Yeah, well, and I usually do that. Because there's a whole lot of resources available for the MCOs that a lot of people don't know
I
about.
don't even know that they're there yet.
Yeah. So St. Peter's does breakfast from 9 to 11, Monday through Thursday. And just so you know, college, ours are Thursdays. Community Kitchen does Monday through Friday, 10 to 12. Saturday and Sunday, 12:30 to 1 is Community Kitchen, both days.
Yes.
Okay. Is anybody else in the valley do hot food? That's it. Okay. Food banks, so we know, Harvest Ministries, I will get in University, Sierra. Joel. Waymaker, I'm at Westminster, and I know that's wrong.
Salvation Army serves hot meals on Thursdays. Actually, they go around delivering hot meals, but they also serve breakfast.
Saturday breakfast, do you know what time?
It's from 7 to 9, I believe.
And then hot meal delivery, they have to sign up with that one though, right?
That's one, but they also, I think they go around, stock my those hot meals.
Okay, I'll just put the breakfast one in there because then from there it becomes.
And also with the group, they also need their fruit. That's Wyoming. Go up there and the.
The one over by, the south,
Wake office.
by the WIC office. And the Saturday food is by the WIC office?
No, that's it.
That's the name of the college. Okay, and I may have those in my calendar. Like I said, loaves and fishes, do y'all know when they're open?
I do. That's in Dexter, the 2nd or 3rd Tuesday, 8 to 11. And the 4th Tuesday, I think it's 5 to 6:30.
Okay, say that again, 8 to 11.
Hagerman.
Oh, I'm sorry, Hagerman. Did you ask me about Hagerman?
Yeah,
Okay.
so 8 to 11, the 2nd Tuesday.
And 3rd Tuesday. And the 4th Tuesday, it's 5 to 6:30 in the evening. And I just got a thing today that said that Roadrunner would be at Dexter Middle School today.
Do they?
That's a new partnership.
Yeah, I think
Sure,
that
they're
is,
gonna be doing lots
cause
of
that's the first we've heard of that.
And I'll go on the Roadrunner website and pull up anybody that they have on the new partnerships on that one. Is there anybody else that y'all know of?
I know two of the schools are doing their distributions, Sierra and.
Yeah, those are Roadrunner. I have, I'll put those on. I just kind of got that one.
Yeah.
The church midway, one that's right there by the daycare, they do it every Wednesday.
Can you give me their information so
Yeah,
I
I'll
have
get that.
accurate information?
Okay.
All right, so one of the other things that I know on the food bank, so I sat through a Roadrunner meeting that they had about a month or so ago, and they have capacity building availability. They have Southeast New Mexico, because I asked them specifically how we compare to other counties within our same demographics, and they said that we use very, a lot of less resources than the rest of the state. Which means that they say that we need more. And that's true, because what we're finding out is all these hot meal sites, all in the food, at the food banks, all stop at 11 o'clock. And they don't work on the weekends.
There's a food bank on the third Thursday of the month at the Unity Center.
Can you give me? Can you put that on? Okay. Unity Center,
Unity Center,
third,
land. Third Thursday of every month.
what's the time?
Let me ask.
And that's a food box?
I believe that they do numbers at 9. And then you come back at a later time and pick up your box.
Oh.
But I'm asking one at a time. I wanted to double check if they were still doing it.
So the reason I have the calendar is that Alianza have people that are coming in that they're not getting resources to food because the food banks have already run out of food. CASA's having the same problem, is that at 11 o'clock, they're out of food over there. They can't get any more food for the rest of the week, you know. It's first come, first serve everywhere. So if anybody is interested in helping anybody create a food distribution area, my thought process, food not bonds would be fantastic. They talked about Roadrunner Food Bank has the money, they could buy a van to do food delivery. They don't have the operational money, they just have the van money.
If, you know Geneva Brumlow, right? We have our church, New Life, we do food as people call, so for the faith. We have the food, just know the transportation and take it around sometimes. Sometimes she has to fit it in and run it around and we get the calls.
That's kind of where we come in, because we're already kind of doing that. She took a food box with some clients mine last week, so the harvest.
So we can provide, if you call with a name, we get together, we're small, but we provide the basket, but it's just to run it around. So I'll get with her and get her to, I don't want to speak and give it, but she has said it, I'll let her talk with you. She's the minister.
So yeah, if anybody's interested in that, there's that. They were wanting to start in several counties across the state, refrigerated Amazon boxes. So think of your Amazon distribution, boxes where you get texted a code and you can go get your Amazon supplies out. Now refrigerate it and put food in it. So if you are a working parent and you can't go to get food picked up until 6:30 at night, and you can't do that anywhere in town, they will text you your code and you can go pick up your food at 6:30. And that's one of their big things that they're wanting to push. But with that, it also needs to have a storefront, because it has to have a place to keep the food before it gets boxed down, put into it. So it's gonna take a lot more capacity building on that. But we need more places like that in town, especially for some of this after hour times. Because if they're a working family and they don't have enough food to cover them for the month, and all these food boxes are once a month, they have to leave their job, or because nobody can pick it up for them. It's a mess for some of these, and we're getting hit, like you saw my list. Food is a huge one on our list. So
So Unity Center, they open the door at 8 for people to get a ticket, but they always have people waiting in line, so they get there like later. They have people bring chairs, sit.
Oh, wow.
so 8 a.m.
8 a.m. to get their ticket. They only hand out a certain number of tickets for the boxes, and then she said it's either 12 or 1 to come get the box, but they'll be told exactly what time.
And you already have the NMU camps and pantry for, Brianna.
I have it listed, but I don't know the details about the pantry. And it's not in the calendar. So details, I'm missing a lot of details of stuff, and it's easier. Like I said, if I put a calendar together and somebody needs access to it, they can read all that information instead of trying to call, because people try to call Salvation Army, it goes into their voicemail, and then they have to wait for phone calls back.
Right.
So that's where we're at on that kind of stuff. We are way past time because it's 1:08 and we still have the drawing, so Jennifer is gonna take that over. Next month I'll be on time.
Well, my 1:30 canceled, so I'm relaxed now.
I'll get the,
Okay,
That's too late.
stop here.
I'll get the information from you. Brianna Bittner is the one that runs the program.
All right. So everybody see your name?
Here's
I got everybody.
Snap on.
That's a slow spin. All right, Geneva. Well, Geneva, I have your thing.
Didn't she just?
She went to she had another meeting.
Oh, yeah.
So.
All right, with that, unless anybody has anything that they really need to.
I want to share something as always. Hey, I was asked by our New Mexico Aging Services to let everybody know the New Mexico Conference on Aging is happening on September the 23rd to 25th. If somebody is getting services from the senior center or from New Mexico or veteran self-directed care programs, it is free to attend. If somebody wants to go, they also have lodging scholarships available, as well as for those that qualify. I've got some flyers that I put back there. Fall open enrollment is October 15th to December the 7th. I will be all over the county. I will be sending out flyers for where I'm going to be at in Chavez. I'll be hitting for people that need to help with getting their Medicare changes made. I've got some brochures back there to prep for that. If you know somebody who's on Medicare, you want to swag, grab one of those, you can. Also information about lowering your cost with Medicare Savings Program and Extra Help. And the big thing I wanted to make sure I mentioned is there's a new scam that I may have mentioned. I don't think I've mentioned it here though, where they get a call and say, if you've got Medicare, you qualify for free in-home services like cleaning, cooking. We can also provide protein shakes. It's all free. They get their Medicare number, their birth date, their address. And then what they do is they actually sign them up for hospice care, and they start billing Medicare for hospice care. And they're not qualified to receive it, but it's a way to get money from the federal government. Typically, they don't even receive any services for that. So please get the word out again. If they get calls asking for their Medicare information, do not give it to anyone unless they know who that person is, a doctor or someone that they know is legally supposed to have that information. Medicare will never call them and ask them for that, and they shouldn't be giving it out over the phone. That's it. And I got swag back there and brochures if anyone wants to grab that.
Anybody else have anything? All right, with that, our next membership meeting is October 8th. Like I said, behavioral health meeting is the 17th, and September 25th, we have the New Mexico Public Health Association meeting, regional meeting at Eastern. You will be getting an email this week with all kinds of updates and flyers on stuff people have sent to me. So if you want your stuff in it, you need to email me today to get it into this week's information. With that being said, I'm calling the meeting to order at 1:11. So I'm calling the meeting to an end at 1:11. Y'all have a great day.
Hey. As usual, good job. Really.